My name is Dr. Rebecca Chen, and I'm the Director of Inpatient Psychiatry at McLean Hospital in Belmont, Massachusetts. McLean is a psychiatric hospital affiliated with Harvard Medical School, one of the most prestigious mental health institutions in the United States. We treat the most severe psychiatric conditions: schizophrenia, bipolar disorder, treatment-resistant depression, psychotic breaks, patients who are a danger to themselves or others. I oversee 4 inpatient units, manage 18 psychiatrists, supervise treatment for 120-plus patients at any given time. I've been a psychiatrist for 19 years, the last 7 as director at McLean. I've treated thousands of patients with delusions, hallucinations, psychosis. I know the difference between reality and mental illness. On November 1st, 2023, I began experiencing my patients' delusions as reality. When a schizophrenic patient tells me there are snakes in her room, I see the snakes. When a paranoid patient insists cameras are watching him, I see the cameras in the walls. When a manic patient believes he can fly, I see him levitating above his bed. Each patient's private delusion becomes real for me, but only when I'm with that patient. When I leave their room, their delusion disappears. I move from patient to patient, entering 50 different psychotic realities, experiencing 50 different versions of truth. I don't know what's real anymore, and I'm starting to wonder if my entire life is someone else's delusion. McLean Hospital has been treating psychiatric patients since 1811. We're known for evidence-based psychiatry, rigorous research, innovative treatments. Our patient population includes people with severe mental illness who need intensive inpatient care, people experiencing psychotic breaks, manic episodes, catatonia, severe depression with psychotic features. I'm 44 years old, born in San Francisco, daughter of Chinese immigrants. My father was an engineer, my mother a schoolteacher. I went to Stanford for undergrad, Harvard Medical School, did my psychiatry residency at McLean and never left. This is my hospital, my career, my life's work. Being director of inpatient psychiatry means I'm responsible for some of the sickest psychiatric patients in the region. I supervise treatment plans, review medications, handle crisis interventions, make commitment decisions for involuntary admission. I know psychosis. I've spent 19 years distinguishing reality from delusion. November 1st, 2023, was a Wednesday. I was doing rounds on Unit 3, our acute psychosis unit. First patient was Sarah Martinez, 32, admitted 3 days prior with acute schizophrenia, auditory and visual hallucinations, paranoid delusions, disorganized thinking. I entered her room at 9:15 a.m. Sarah was sitting on her bed, visibly distressed. "Dr. Chen, they're here again. The snakes, on the floor, on the walls, everywhere." I looked around the room. Standard psychiatric room, bed, chair, small desk, window with safety glass. No snakes. "Sarah, there are no snakes. What you're seeing is a symptom of your illness. We're adjusting your medication to help." Then I saw them. Snakes. Dozens of them. Writhing on the floor, coiled on the windowsill, slithering up the walls. Black, green, brown. Some small, some massive. Moving, hissing, real. I froze. My heart raced. They were everywhere. "You see them now too?" Sarah asked, her voice breaking. "You see them? I'm not crazy." I couldn't speak. I was staring at a 6-foot snake coiled by the door, blocking my exit. "Dr. Chen," Sarah said. I blinked, forced myself to look away from the snakes, to focus on Sarah. Yes, I see them. So they're real? I'm not hallucinating. The snakes were still there. I could see them clearly. Moving, breathing, real. But I knew they weren't real. This was Sarah's psychotic symptom, schizophrenia causing visual hallucination. There were no actual snakes in this room, but I was seeing them. I backed toward the door, eyes on the snakes, reached for the handle. My hand passed through the 6-foot snake blocking the exit. It felt like nothing. No resistance, no texture, just air. I opened the door and stepped into the hallway. The snakes vanished. Instantly. Completely gone. I looked back into Sarah's room. Empty. Clean floor. No snakes. But Sarah was still seeing them. She was pressed against the headboard, staring at the floor in terror. I stepped back into the room. The snakes reappeared. Dozens of them, writhing on the floor, exactly where they'd been before. I stepped back into the hallway. They disappeared. I was experiencing Sarah's hallucination. When I was in her presence, in her room, I saw what she saw. When I left, the delusion ended. I steadied myself against the wall. This wasn't possible. I couldn't be experiencing a patient's psychotic symptom. Hallucinations don't transfer between people. Reality doesn't change based on proximity to a schizophrenic patient. I went back into Sarah's room, forcing myself to stay calm. The snakes were there again. Sarah, I need to step out for a moment. I'll be right back. I left, went to the nurse's station, tried to collect myself. Nurse David Kim looked at me with concern. Dr. Chen, are you okay? When you were in Sarah Martinez's room earlier, did you see anything unusual? Like what? Snakes. Did you see snakes? He looked at me strangely. No. She's been reporting snakes since admission, but there's nothing there. It's her schizophrenia. Right. Of course. I just needed to confirm. But I'd seen them, as clearly as I was seeing David now. They'd been real while I was in that room. My second patient that morning was Marcus Williams, 47, paranoid schizophrenia with persecutory delusions. He believed he was under constant surveillance, that the government was monitoring his thoughts, that cameras were hidden in every room. I entered his room at 10:30 a.m. Dr. Chen, don't speak freely. They're listening. He pointed at the ceiling. Cameras, microphones, in the vents, in the light fixtures, behind the mirror. They watch everything. I looked where he pointed. Standard hospital room. No cameras. Marcus, we've discussed this. There are no cameras. Your medication will help reduce these paranoid thoughts. Then I saw them. Small black cameras embedded in the air vent. A microphone hidden in the smoke detector. Tiny lenses in the ceiling corners. Surveillance equipment everywhere. I stared. They looked professional, sophisticated. Government-grade surveillance. You see them now, Marcus said quietly. You understand. I'm not paranoid. They're really watching. The cameras were there. Small red lights blinking. Active. Recording. I looked at the mirror. Behind the glass, I could see the outline of recording equipment, wiring, technology that shouldn't exist in a psychiatric hospital room. Dr. Chen, we can't trust anyone. They've compromised the whole hospital. I stepped toward the door. As I crossed the threshold into the hallway, the cameras vanished. All of them. Instantly gone. I looked back into Marcus's room. Clean ceiling. Normal vents. Standard mirror. No surveillance equipment. I was experiencing his delusion. When I was with him, his paranoid reality became mine. When I left, it disappeared. I went to my office, closed the door, sat at my desk trying to understand what was happening. Two patients. Two completely different delusions. Both had become real for me when I was in their presence. This couldn't be stress. This couldn't be fatigue. I was experiencing genuine psychotic symptoms from my patients, symptoms that appeared and disappeared based on physical proximity. Over the next week, I continued rounds, and it happened with every psychotic patient. Patient with bipolar mania who believed he could fly. I saw him levitating 3 feet above his bed, floating, defying gravity. Left the room. He was lying in bed normally. Patient with schizophrenia who heard demons. I heard the voices too. Raspy, menacing, coming from the corners of the room. Stepped into the hallway. Silence. Patient with delusional parasitosis who believed bugs were crawling under her skin. I saw the bugs. Thousands of tiny insects moving beneath her skin, creating ripples on her arms. Left the room. Her skin was clear. Patient with Cotard's delusion who believed he was dead. When I sat with him, the room felt cold, lifeless. His body looked corpse-like, gray, decomposing. His voice sounded hollow, distant. Stepped outside. He looked like a normal patient, very much alive. I was experiencing 50 different psychotic realities. Each patient's delusion became my reality when I was with them. And each time I left, I returned to what I thought was baseline reality. But I was starting to question, what was baseline? Which version was real? On November 8th, I had a patient named Jennifer Davis, 29, first psychotic break, experiencing elaborate delusions about being in a simulation. Dr. Chen, none of this is real. This hospital, you, me, we're all in a computer simulation. Nothing is real. It's all code. I sat with her, prepared to experience her delusion, and the room started to pixelate. The walls became visible as rendered graphics. Jennifer's face showed polygon edges. The window displayed obvious texture mapping. Everything looked like a video game, detailed but artificial, constructed, not real. I could see the underlying code, numbers and symbols overlaying everything. The hospital room as data. You see it now, Jennifer said. We're not real. We're programmed. I stood up, feeling the floor. It felt solid but looked like a rendered surface. I touched the wall. It felt real but appeared as digital texture. I left her room. The pixelation disappeared. The hospital looked normal again. Solid, real, material. But I couldn't shake the feeling. What if Jennifer was right? What if I'd just seen the truth? That everything was simulation, and normal reality was the delusion. On November 15th, I requested a meeting with Dr. Patricia Morrison, the chief of psychiatry at McLean. Patricia, I need to discuss something. I've been experiencing my patients' delusions as reality. When I'm with a psychotic patient, I see what they see, hear what they hear. Their delusions become real for me. She studied me carefully. Rebecca, you're describing shared psychosis. Folie à deux. But that requires extended intimate contact, not brief clinical encounters. It happens with every patient, every delusion. Snakes, cameras, flying, demons, simulation theory. I experience all of them when I'm in the patient's presence. How long has this been happening? 2 weeks. Every psychotic patient I see, their private reality becomes my reality. Rebecca, this sounds like you might be experiencing burnout, compassion fatigue, or early signs of your own mental health crisis. Psychiatrists aren't immune to mental illness. I know the difference between mental illness and what I'm experiencing. This is something else. Then you need to step back, take medical leave, get evaluated. I can't have my director of inpatient psychiatry claiming to experience patients' delusions. On November 20th, 2023, I was placed on mandatory medical leave. 19 years as a psychiatrist, 7 as director, ended because I'd reported experiencing shared psychotic symptom. I underwent psychiatric evaluation with Dr. Stephen Park, a colleague from outside McLean. Rebecca, tell me about these experiences. When I'm with psychotic patients, I enter their delusional reality. I see their hallucination, experience their delusion. When I leave their presence, it stops. Do you believe the delusions are real? I don't know what real means anymore. When I'm with Sarah, the snakes are real. When I'm with Marcus, the cameras are real. When I'm with Jennifer, the simulation is real. Each reality is internally consistent, fully experiential. Which one is the delusion? The delusions are the patient's symptom, Rebecca. You're a trained psychiatrist. You know psychosis when you see it. But what if I'm wrong? What if Sarah really sees snakes that I normally can't see, but proximity to her allows me to perceive them? What if Marcus really is under surveillance and I'm usually blind to it? What if Jennifer is right and we're in a simulation? Rebecca, that's paranoid thinking. You're starting to adopt your patient's psychotic worldviews. Or I'm finally seeing the truth. Maybe reality is plural. Maybe there are multiple valid realities, and psychotic patients access versions we normally can't perceive. Maybe I'm not experiencing delusion. Maybe I'm experiencing expanded perception. Dr. Park's assessment. Dr. Chen is showing signs of psychotic disorder, possibly induced by prolonged exposure to severely mentally ill patient. Recommend extended leave, antipsychotic medication, and intensive therapy before any return to clinical practice. I refused the antipsychotics. If I was experiencing my patient's realities, medication would close that door. I needed to understand what was happening first. On December 1st, I went back to McLean unofficially. Not as director, I'd been removed from that position, but as a visitor. I needed to see if the experiences would continue without the clinical context. I visited Sarah Martinez. Her schizophrenia was improving on new medication, but she still had residual hallucination. Dr. Chen? I thought you weren't here anymore. I'm just visiting. How are you feeling? Better. The snakes are smaller now. Less frightening. The medication helps. I looked around her room. No snakes visible. I sat with her for 10 minutes. Still no snakes. The shared delusions had stopped. Without my role as her psychiatrist, without the clinical relationship, I didn't enter her reality anymore. I visited Marcus Williams, sat with him for 15 minutes. No cameras appeared. His delusion remained his alone. The experiences were tied to my role as their psychiatrist. When I was clinically responsible for them, their delusions became real for me. Without that responsibility, I couldn't access their realities anymore. On December 10th, I took a job at a small community mental health clinic in Western Massachusetts. Basic outpatient psychiatry, no inpatient work, no severely psychotic patient. I saw patients with depression, anxiety, PTSD, mild bipolar disorder, none with active psychosis, none with delusion, and I didn't experience any shared symptom. My reality remained singular, stable, but I missed it. I missed the multiple realities. I missed seeing what my patients saw, understanding their experiences from inside their perception rather than from clinical distance. On January 15, 2024, I received a call from McLean. Dr. Morrison, Rebecca, we need you back. Our new director isn't working out. The units are struggling. You understood these patients in ways no one else does. Whatever you were experiencing, whether it was real or not, it made you effective. Please come back. Patricia, I was placed on leave because you thought I was psychotic. I was wrong. Or maybe I was right, but it doesn't matter. You were the best director we've had. The patients improved under your care. The staff trusted you. We need you. What about the delusions? If they start again, then manage them. Use them. I don't care how you do it, but come back. On February 1, 2024, I returned to McLean as Director of Inpatient Psychiatry. My first day back, I did rounds on Unit 3. Sarah Martinez had been discharged. A new patient occupied her room. Daniel Torres, 34, schizophrenia, visual and auditory hallucinations. I entered his room at 9:30 a.m. Dr. Chen, the walls are bleeding. The room is filling with blood. I'm going to drown. I looked at the walls. Blood was seeping through the paint, dripping down to the floor, pooling around the bed, rising slowly. Daniel was standing on his bed, terrified, watching the blood level increase. I could see it, feel the cold dampness, smell the metallic scent. It was real. His delusion was my reality again. Dr. Chen, you see it. The blood. It's real. I see it, Daniel. But it's a symptom of your illness. We're going to adjust your medication to help you. How can you help if you see it too? Because I understand what you're experiencing. I can see your reality. And I can help you find peace with it, or change it, or learn to live alongside it. I stepped out of his room. The blood disappeared. I stepped back in. It returned, floor covered, walls dripping. Over the next month, I treated 47 patients with psychotic symptoms. I experienced all of their delusion. Patient who believed insects lived in his brain. I saw them crawling behind his eyes, moving beneath his skull. When he tilted his head, I could see them shift, adjusting their position inside his cranium. Tiny legs pressing against the inside of his eye socket. I could hear their chittering, faint but constant. Patient who thought she was made of glass. When I looked at her, she appeared translucent, fragile, transparent. I could see her organs through her skin, heart beating visibly, lungs expanding, blood flowing through translucent vessel. When she moved, I heard faint crystalline sounds, like glass chimes. I was terrified to touch her, certain she would shatter. Patient who believed time was moving backward. While with him, I experienced time reversing. Conversations happening in reverse, movements rewinding, everything flowing backward. He would speak and I'd hear the words in reverse order. He'd gesture and his hand would move backwards through the motion. The clock on the wall ran counterclockwise. My own thoughts seemed to flow backward, ending before they began. Patient who thought she could read minds. I could hear her thoughts clearly, like she was speaking aloud, even when her lips didn't move. Stream of consciousness, unfiltered, direct access to her internal monologue. Dr. Chen looks tired. Is she judging me? I should have brushed my hair. She thinks I'm crazy. Of course she thinks I'm crazy. Everyone thinks I'm crazy. All of it audible, layered over her actual speech. Patient with Capgras delusion who believed her husband had been replaced by an imposter. When her husband visited, I saw him too. The same face but slightly wrong. Eyes slightly different color. Voice slightly off pitch. Movements subtly wrong. The imposter was convincing but not perfect. I understood her terror. This wasn't her husband. This was someone else wearing his face. Patient who believed he was the President of the United States. When I sat with him, the hospital room transformed into the Oval Office. The walls displayed presidential portraits. Secret Service agents stood by the door, nurses, but I saw them as agents. His hospital gown appeared as a suit. Papers on his desk looked like presidential briefing. The delusion was complete, detailed, fully realized. I lived in 50 psychotic realities simultaneously, switching between them as I moved from patient to patient. And I realized something. I was a better psychiatrist for it. When I told Sarah I understood her snakes, I wasn't lying. I'd seen them. I knew the terror. When I told Marcus his paranoia was understandable, I meant it. I'd seen the cameras watching him. When I told Jennifer the simulation felt real, I'd experienced the pixelation myself. I wasn't just clinically empathizing. I was truly understanding their realities from the inside. On March 1st, a new patient was admitted. Elena Volkov, 38, first psychotic break, elaborate delusional system. I entered her room at 2 p.m. Dr. Chen, I need to tell you something. None of this is real. You're not real. I'm not a patient. This isn't a hospital. You're part of my delusion. I sat down. Tell me more. My real life is somewhere else. I'm a psychiatrist too. In my real life, I'm the director of inpatient psychiatry at a hospital. But I started experiencing something strange. I began seeing my patients' delusions as reality. And then I had a psychotic break from the stress. Now I'm the patient. You're my delusion. This whole hospital is my delusion. I felt cold. Elena, what's the name of the hospital where you work? McLean Hospital, in Massachusetts. I'm Dr. Elena Volkov. I've been director for 7 years. And you started experiencing shared delusions with patients? Yes, in November. I thought I was going crazy. And then I realized, maybe I was. Maybe I'm still at McLean, but I'm the patient now, not the director. Maybe you're my psychiatrist, and I've created this elaborate delusion where I'm visiting myself. I stood up, walked to the door, looked back at her. Elena, I'm Dr. Rebecca Chen. I'm the director of inpatient psychiatry at McLean Hospital. I started experiencing shared delusions with patients in November 2023. Everything you're describing, I've experienced. No, that's my delusion. You're part of my psychotic break, or you're part of mine. We stared at each other. If she was delusional, then I was real and she was my patient. If I was delusional, then she was real and I was her patient. If we were both delusional, then we were both patients experiencing shared psychosis. If neither of us was delusional, then reality was genuinely plural and we were both accessing something others couldn't perceive. I didn't know which was true. I spent an hour with Elena. She described her experiences in perfect detail. The snakes in Sarah's room, the cameras in Marcus's room, the simulation with Jennifer. Every detail matched my memories exactly. How do you know about Sarah? I asked. Because I treated her. She was my patient. Or she was my patient and you're accessing my memories as part of my psychotic break. Or you're accessing mine. We were trapped in an infinite mirror. Each of us potentially real. Each of us potentially the other's delusion. No way to determine which was primary. What if we're both real? Elena asked quietly. What if we're both experiencing the same phenomenon? Two psychiatrists independently accessing patients' delusional realities. Then why do we have such similar experiences? Why would we both start in November, both be directors at McLean, both experience the exact same delusions with the same patient? Maybe we're not at the same McLean. Maybe there are parallel McLeans, parallel realities, and we're both directors accessing our own version. Or one of us is real and created the other as a psychotic elaborate delusion to avoid accepting we're mentally ill. We had no way to know. On March 15th, I had another patient who claimed to be the real Rebecca Chen, a psychiatrist experiencing delusion. On March 22nd, a patient claimed to be the real Dr. Morrison, the chief of psychiatry, who had broken down from stress. On April 3rd, a patient claimed to be the real director of the hospital, experiencing an elaborate psychotic episode. Multiple patients, all claiming to be the real person whose delusion created everyone else. I started to wonder, was I real? Was I Dr. Rebecca Chen, psychiatrist? Or was I someone's delusion? A character in a patient's psychotic worldview? When I experienced Sarah's snakes, was I entering her reality or was she creating mine? When I saw Marcus's cameras, was I perceiving his delusion or was he generating the reality I existed within? What if my entire life, my childhood, my medical training, my career at McLean, was someone else's elaborate delusional system? What if I was never real? I'm 44 years old. I'm the director of inpatient psychiatry at McLean Hospital. I've been a psychiatrist for 19 years. Or I'm a patient experiencing a delusion that I'm a psychiatrist. Or I'm a character in someone else's delusion, and none of this is real. I experience my patients' delusions as reality. I see their hallucinations, enter their psychotic worlds, live in 50 different realities as I move from room to room. But I don't know which reality is primary. I don't know if I'm experiencing my patients' delusions or if they're creating me as part of their delusion. Reality is plural at McLean Hospital. Every patient has their own truth, and I exist in all of them simultaneously. Maybe that's what it means to truly understand someone's mental illness. Not to observe it from outside, but to live inside it. To let their reality become yours, even if it means losing certainty about which reality is real. I treat my patient. I adjust their medication. I help them find peace with their symptoms or reduce them or learn to coexist with them. But I no longer tell them their delusions aren't real. Because when I'm with them, Their delusions are real. The snakes are real. The cameras are real. The simulation is real. The bleeding walls are real. And when I step outside, my normal reality returns. But I'm no longer certain it's more real than theirs. Maybe we're all living in delusion. Maybe reality is just the delusion we agree on collectively. Maybe my patients see truths the rest of us are blind to. Or maybe I'm a patient myself, and this entire narrative is my psychotic break. I don't know anymore. And maybe that's okay. I'm Dr. Rebecca Chen. Or I'm a patient who believes she's Dr. Rebecca Chen. Or I'm a delusion in someone else's psychotic mind. I work at McLean Hospital. Or I'm a patient at McLean Hospital. Or McLean Hospital is a delusion. I experience 50 realities every day. Or I experience one reality that fragments into 50 delusions. Or there is no reality, just infinite delusions creating each other. I've stopped trying to find the answer. I just move from patient to patient, entering their worlds, living their truths, and trying to help them however I can. Because in the end, whether I'm real or not, whether they're real or not, whether any of this is real or not, the suffering is real. The fear is real. The need for help is real. And that's enough.